John Lokoloi. I wish to request you to remain standing for the national anthem, the East African Community National Anthem, as well as the EACC Integrity Anthem. Asanteni.
Allahu Akbar.
Mabibi na mabwana, asanteni. You may asanteni. We are going to have a brief interlude and entertainment from Visa Osho Primary School. But before we do that, I'd like to recognize the presence of some of the dignitaries who are here. I know I started with our very own Cabinet Secretary in the Ministry of Health, Madam Susan Nakhumicha Wafula, who's here with us. Asante sana kwa kuja. I also want to recognize the presence of Dr. Richard Elbach, the Deputy Development Director at the British High Commissioner, here with us today. Let me also recognize the presence of Mr. Neil J. Walsh. He's a regional representative and head of mission for Eastern Africa. Without forgetting also the newly sworn-in chairman and chairperson of the EACCC, Bishop David Oginde. Karibu sana kuwa pamoja nasi. All the commissioners from EACC, thank you so much for making time to be with us. And I know there's so many organizations well represented here today. I'll be making a mention in other segments. Just briefly, allow me just only to mention the organizations that are here, and we'll get to know each other better later on. But first and foremost, let me invite Visa Osho Primary School. They have a wonderful shairi. They're going to recite to us. And then we'll continue with our program. Visa Osho, makofi kwa tafadhali as you come in.
wanachama wa uadilifu kutoka shule ya msingi ya Visa Ocean. Karibuni. Wasia wangu natua tilieni maanani, taifa kuimarika tukipinga ufisadi. Ufisadi huuzimwi maeneo nchini kote. Afya na uadilifu ndio ustawi wa nchi. Kenya nchi yangu nzuri, ninafaa kuilinda vilivyo dhidi ya mambo mabaya. Huo ndio uzalendo pamoja na uadilifu. Afya na uadilifu ndio ustawi wa nchi. Mwananchi mzalendo hawezi kosa upendo. Upendo uwe daraja au ni kwa maskini. Hasla hana hanani, akipewa tashukuru. Afya na uadilifu ndio ustawi wa nchi. Mwananchi mzalendo ni vyema wajibike. Matibabuni kienda tapata madaktari. Takutibu kwa wakati, afya itaimarika. Afya na uadilifu ndio ustawi wa nchi. Tamati nimefikia, kiamini nimeelewa. Ni vyema kuzingatia afya na uadilifu. Kwako naomba Rabuka, uibariki nchi yetu. Afya na uadilifu ndio ustawi wa nchi. Shukran.
Asanteni sana, makofi tena tu Visa Ocean. Nafikiri wametupatia changamoto haswa katika Wizara ya Afya, na tunajivunia kuwa na waziri mkakamavu, shupavu. Mlimsikia juzi akizungumza akisema atakabiliana na masuala ya ufisadi, au sio? Tumpeni makofi waziri wetu, manake yuko mbioni. Amesema pale atafagia na kutakuwa shwari. Sasa aliposema vile, mimi nikawa nahurumia wafanyikazi katika Wizara ya Afya, manake nasikia sikizo wanasema kitawaramba. Sawa. Bila kupoteza muda basi, let me invite Director in the Preventive Services at the EACC, Bwana Vincent Okongo, to start us off with a presentation of the highlights and the key findings of the survey report by the Ethics and Anti-Corruption Commission. Karibu sana, Bwana Vincent Okongo.
Thank you, Nimrod. My name is Vincent Okongo, Director Preventive Services of the Ethics and Anti-Corruption Commission. Madam Cabinet Secretary, Ministry of Health, Susan of EACC, Dr. David Oginde, EACC Commissioners present, Dr. Richard Albert, representative of the British High Commission in Kenya, Mr. Neil Walsh, Regional Representative, UNODC, East Africa, distinguished guests, ladies and gentlemen, good morning. Yes, I will be taking you through the highlights of this particular study report, and I will start by giving a short introduction and a brief understanding of why we carried out this study by way of rationale, what were the objectives that drove us to undertake this study, a bit of the methodology, but you can read a lot of it in the document itself. And then I'll finalize by looking at the key findings and recommendations that should take this particular challenge a notch higher in terms of addressing the corruption issues that by saying that has been indicated in that report and elsewhere, corruption is still a major challenge, especially to the attainment of the universal healthcare coverage. Of course, it undermines the integrity and credibility of the healthcare system. It really erodes public trust and also leads to misallocation of resources, especially that which is meant for we noted in 2019 that accounted for all briberies that were paid at a rate of 17.5%. A challenge that we need to deal with. And consistently, the surveys that we have conducted as a commission, and even by TI, has indicated that the most likely government agency to encounter corruption are two. One of them is the police, and the second one is the Ministry of Health. And of course, NHIF followed very closely, and Health Department in county government. So you can see, and this has been a consistent finding, I think, ever since we started carrying out these surveys. On the flip side, we also note that the government has allocated massive risk sector. For instance, in the year 2017-2018, between 2017-2018 and 2021-2022, over 955 billion, or 6% of the cumulative national budget, was geared towards health services. Total budget expenditure by counties, again, was about 508 billion, of which 420 billion accounted for recurrent expenditure, and 88 billion accounted for development. That is according to the recent economic survey that was released. During the COVID pandemic, the national government expenditure geared towards mitigating the effects of COVID-19 stood at 60.8 billion shillings, out of which development accounted for 42.3 billion, and 76.5% was geared towards public health services. County governments, on the other hand, their recurrent expenditure geared towards addressing COVID-19 was 8.91 billion, which showed an increase of about 17.4%, and a development of 17 billion, which is again was an increase of 9.4%, according to the economic survey of 2020. So then you can see, on one hand, we have a very serious government budget allocation. On the other hand, we are acknowledging the challenge of corruption that still exists. So, and when we look at global indicators, some of which have been there for some time, for instance, the Global Corruption Report of 2011 indicated that Kenya's healthcare system was affected by conflict of interest, lacking accountability mechanisms, and of course, there was challenges of transparency, professionalism, abuse, and misappropriation of funds. Our own surveys, again, as I mentioned, has consistently talked about the Ministry of Health as ranking as one of the top institutions on the anti-corruption index. Several reforms we know have been pursued in the sector to, for example, enhance public procurement and financial management accountability. There has been persistent, but we still see persistent corruption and unethical practices in these areas. So there was need for us to have an in-depth understanding of the extent of corruption and unethical practices in the sector, much more specifically focusing on procurement and financial management. We carried out this in collaboration with the UNODC to be able to focus on the nature, magnitude, causes of corruption and unethical. So by way of objectives, we were intended to identify the nature and magnitude and causes of corruption in those areas, evaluate the extent of adherence to public procurement and financial management laws and attendant regulations, identify and evaluate effectiveness of measures that have been pursued by different procuring entities to combat corruption and unethical practices in the sector, identify challenges in the implementation of healthcare projects, and finally, propose measures and strategies that can help to address the identified challenges. By way of methodology, this was a cross-sectional research design where we were collecting data at a single point through face-to-face interviews, and we were also able to peruse documents like files, and we had site visits to various projects. We were also able to examine select variables to establish patterns of association with corruption and unethical practices. And the scope there was, and coverage was 25 counties, namely as they are indicated in the slide, and also the public healthcare projects. Our target respondents were, as indicated, Employees from public health facilities were the majority in terms of 1,190. Procurement and financial experts who are key informants, contractors who are involved in project implementation, as well as the public. So let me now turn to the key findings. Projects are budgeted for. They are planned, they are budgeted, they are implemented. At some point, they are terminated. So across the chain, we were able to observe a number of malpractices that lend credence to corrupt conduct. For example, at the budgeting stage, the nature of corrupt and unethical conduct were in the identification of projects was cost inflation, followed by undue influence. If you read the report, you will see a number of other forms of corruption, but those were the key leading ones when it comes to budgeting and identification of projects at that level. Then in initiation of health projects, there was a high level of favoritism. It's like there are people who understand the sector and able to influence or influence peddle, if you like, to get attention, followed by conflict of interest and bribery. So when projects are initiated, those are the factors that really contribute to the forms of corruption that are most prominent. At the planning stage, there is the issue of manipulation of cost that, of course, leads to cost inflation. There are distortion of procurement plans which have been duly approved for implementation. And again, favoritism becomes a running theme in most of the areas you will see me talk about. At the tendering stage, there is the aspect of tender initiation, favoritism at 41.7%, bribery at 16.8%, and again, conflict of interest at 13.5%. When it comes to tender opening, again, favoritism comes in, followed by conflict of interest. When it comes to tender evaluation, you can see even at the tender award stage, favoritism is consistently leading. So it's important to find out what are the loopholes, what are the challenges that lead to that kind of malpractice in the ministry. And I think that's the next stage that we need to really focus on. Then in terms of project implementation, we noted payment of standard substandard works, leading at 64.1%, again followed by bribery to ensure that the payments are done even when projects have not been completed. And of course, at the project termination stage, again, payment for substandard works, bribery, and delayed payments contributed seriously to the challenges that the sector. So in a nutshell, some of the irregularities and issues, I'll share with you specific projects where we noted some specific practices. For example, the level of public participation and involvement, 42.0%. We noted instances of similarities between the tender sum and the budgeted sum. We know now the procurement law allows us to publish what you have, your procurement plans online. But before this study, when this study was being done, that was not the case. But we know as we speak right now, the law requires that you put your procurement plan online. So this is pointing to some level of collusion because that closeness has a missing link. Then in some project files, the team noted missing documents, especially the approved procurement plan, requisition, advertisement notice, BQs, engineers' estimates, evaluation reports, and even performance bonds. Sometimes progress reports, updated payment details, and certificate of project completion were not there. So the project stated in many cases indicated complete despite clear evidence of incomplete workmanship. So allow me to talk just about one or two projects. One of the projects we looked at was the construction of outpatient department in Elders Wajir County. And as at 9th June 2021, the irregularities that we noted were evidence of poor workmanship. The approved requisition and budget were not available in the project file. And of course, the project was not in use despite being complete. Secondly is the construction of Tulu Magunga Dispensary in Migori County. On 5th June 2021, we noted performance bond was missing in the project file. The project status was indicated as complete, but the lavatories shows incomplete and poor workmanship. And some of the pictures are there. If you look at the report, you'll be able to see it. Thirdly is the construction of the proposed Kakamega Teaching and Referral Hospital. By 31st May 2021, project completion period expired, but the project was yet to be completed. Details were missing in the file, including approved requisition and budget, evaluation report, BQs, project reports, engineers' estimates, and updated payments. So then, what is the perception on existence of corruption in the health sector generally? According to health staff, perception on existence of corruption stood at 86.7%. These are people working in that sector acknowledging that indeed there is a serious problem, followed closely by the general public at 81%. When it comes to perception of existence of corruption in healthcare at the county level, again, health workers were indicating that at 60% were saying that it exists, and of course the general public at 70%. So the first bars are at the national level, the second set of bars are at the county level. So I think the point to note is that even actors in the sector are acknowledging that there's a serious challenge that needs to be dealt with. In terms of spread of corruption and unethical conduct in the health sector, health staff were saying that corruption is widespread at 88%, while members of the public were even higher at 93.7%. When those who said it was negligible was a paltry 8.5% for the health staff and 4.2% for the general public. So you can see, again, there is serious acknowledgement that corruption is widespread in that sector. In the area of procurement stages where corruption and unethical practices is rampant, as I noted at various levels, tender initiation for health staff accounted for 43.6%, while for the contractors, now we are also talking to contractors, were saying that corruption was rampant at 49.5% when it came to tender awards. And then tender evaluation, the contractors were saying at 34.1% that corruption was very high compared to 17.5% of the health sector staff. And that goes on in terms of initiation, implementation, planning, invitation to tender, tendering, opening, and closure. The red bars indicate in all stages, those are contractors speaking, and they are saying there's a serious problem of corruption at the tendering stage. In the area of financial management procedures, where corruption and unethical practices were noted as rampant again, estimating the cost of projects was one critical area, leading with 33.1%. Tender documents and project stages, adherence to laws and regulations, 13.6, identification of projects to be undertaken, 8.4, and you can see ensuring that there are no double payments, 7.9%, all the way to checking for proper respect or adherence of rules and regulations on the commitment of funds level at about 2.1%. at 35 points. Improvement in healthcare services. The public are able variations. In terms of awareness of healthcare projects completed beyond the contract period, Kanithi and Embu come very close. Homa Bay follows. Kajiado, Meru, in terms of how these counties ensure they are adhering to timelines and budgets that have been set. In terms of challenges in the implementation of healthcare projects, we noted that the critical issue that was noted were financial constraints. Probably money was not flowing as required, or probably the budgets were not accurate. Secondly, there was delay in approvals of funds. Corruption followed very closely, understaffing, political interference was also there at 6.0%. Bias in selection of contractors, lack of public participation, poor planning, all the way to inadequate oversight of those projects. So out of that, because this is just a flavor of what is in the report, we have highlighted a series of recommendations that in our view, if taken up as a matter of urgency and systematically, can lead to transformation of the sector and to ensure that we are able to get value for money as well as rid it of corrupt and malpractices. Establishment of anti-corruption measures by institutions is just preventive measures. Mainstreaming corruption prevention is a key area that the ministry and related agencies really need to look at. It's a proactive approach to the fight against corruption. Building capacity of people who are involved in projects to understand their roles and responsibilities and to be able implementation of information management system so that at each stage of the project management cycle, we're able to have real time that informs decision making going forward. Allocation contributed to, for example, delays or quality of
And it is a real